The next procedure I'd like to talk about is liposuction. That's a great operation, and I tell people you can go to the gym and exercise and work out, or you can come in and have an hour or two of liposuction and really get ahead of the curve, if you will. Instead of starting the 100-yard dash on the goal line, or the starting off, you're on the 40 or 50-yard line, so it makes it easier to run the race. But I think it's important, that being said, that people understand liposuction is not a substitute for weight loss. I see patients all the time in my practice that think, well, I'm 100 pounds overweight, let's do some liposuction. It really is not intended to do that, and I will not do it on people with that premise in mind, because we're very limited in what we can do. But liposuction basically is the removal of fatty tissue that has accumulated in abnormal deposits. I think the classic example that everybody knows about is a saddlebag deformity. It's genetically predetermined. Mom had it, grandma had it, my aunt has it, my sister has it, guess what? I've got it. And it doesn't necessarily mean obese. I've done liposuction. I remember a young gal that I did lived in Pine Island. She was like, 95 pounds dripping wet, but she had these little saddlebags. No matter how much she exercised, no matter what she ate, they just wouldn't go away. So we did liposuction. We removed maybe 50 or 75 cc's of fat, and it was gone. So one of the risks with liposuction, obviously, is asymmetry. Now, most women are not symmetrical, so when they come in for liposuction, let's say of the inner thighs or the saddlebags, there may be some inherent asymmetry there. And so it's really a guesstimate, if you will, how much fat is on one side versus the other side. So we try to get it as symmetrical as we can, and sometimes, maybe 5–10% of the time, we may have to go and do a little touch-up. Again, it's important to understand that the areas that we liposuction, for example, the hips, the abdomen, may be insensate for a while. So you just have to be careful going out to the beach and getting sun, because it can be non-sensitive, and you may not be aware of getting a sunburn. I think the most common risk that I see, unfortunately it's rare, it's common in the sense that it's unique to liposuction, and that's grooving of the skin. Generally speaking, you have your skin, you have your fatty tissue, and then the muscle. The thickness of that fatty tissue, you've got to be careful. As that layer of fat is diminished, the risks become greater for grooving, notching, indentation, and this can be a bear to correct. So generally speaking, it's important that as you get less and less fatty tissue between the skin and the muscle, that you use smaller and smaller cannulas. I remember when I started doing liposuction 25–30 years ago, we used bigger cannulas. Now the cannulas we use are much, much finer. They're more narrow. There may be a couple millimeters or less. So it's very, very important to understand that grooving, indentation, dimpling can occur after liposuction. But ways we minimize that is by the type of cannulas that we use. And this has gone a long way to eliminate that for the most part in performing liposuction. Another thing that's important to understand is when you do liposuction, like before, we talked about the fact that after the liposuction, as the swelling subsides, you may feel little nodules underneath the skin. Again, these are areas of maybe some coalescing of some bruising or bleeding or fat necrosis, and heat and massage will sometimes get rid of that as well. And usually it might be 2 months, 3 months, 4 months, and as time goes on, they dissipate and go away. But by and large, liposuction is a great operation. It's a wonderful way to get rid of diet-resistant fat, because there are people, there's no question, no matter how much they run, no matter how much they exercise, they just can't get rid of it. But liposuction is a good answer to their dilemma, to their problem.